I think it was a move towards relevance, to where students could see a direct connection with nursing. The number one comment sometimes we get as educators is, well, I'm going to be a nurse, not a writer. And it's really teaching students that how you think and how you group things together, how you formulate your thoughts, all of that makes you critically think, which is nursing. So I think that's kind of it's an attempt to provide relevancy, and it's also an attempt to provide a means that it's usable, that the students can use the same content to teach the community, to teach themselves, and also to provide a way for them to learn to collaborate with other, which is a vital nursing skill. I'm still working on that. Right now it's very much geared to creating a central, clear message that's on health promotion. It's less of a focus on APA formatting, though that's important, and I'm trying to get at that piece from a different angle, kind of more questions on that from just a standard test kind of question. I'm wanting to see if they can take this large volume of information and distill it down, which is what you have to do with patients. The rubric itself is organized with those nursing process categories, like assessment is kind of married up with that information literacy piece, finding your topic, researching your topic, planning, same sort of thing, implementing, really getting down to the mechanics of writing and the subject matter of what you're speaking on. Evaluation is important too, which is part of the nursing process. Part of the rubric is were they able to kind of did their thesis statement get answered, basically, purpose of the paper. What they learn from doing the paper is then used to create a concise sound bite, so to speak, with the poster, and then the poster is used to give a small presentation with the community at large that were invited to be a part of that topic, like the speech and hearing clinic was definitely this last semester. Other semesters, the veteran support groups, we always tried to go to those actual groups and show a presence, talk with people that were part of that. The speech and hearing clinic came and brought some of their students with them, so my students got a chance to really talk with them about what they had learned. So I guess for me it's that it's very threaded through, and it's very at the application level rather than just the knowledge level.